Good afternoon, everybody. Today is June 24th, 2022. My name is Scott McGann with the Falmouth Health Department, doing our weekly COVID-19 update. Our website's falmouthma.gov. Our email is health@falmouthma.gov, and our phone number is 508-495-7485. Sorry for the head cold. I am COVID negative, just to let you know, but I do have a head cold and a little sinusally in my voice today. So we have a total case count of 4,930, which is 48 for the week. Confirmed PCR, again, unknown actual case count, and it's been like that for a while because of home tests. 6 probable this past week, which would be rapid tests like a Convenient MD that we would have done before home kit tests were out there. Our incidence rate has dropped to 17.4 from 24.5, and our positivity is 5.49, previously at 7.15. So our case count's pretty flat from last week. It was a similar number within 10 last week as well. This might be sort of our baseline for the summer. The new variants are generally, less severe, especially with vaccines. And then you add, so I think our baseline is, this could be somewhere in our baseline for the summer, or it will continue to drop. Not sure yet. And as far as where we're considered by CDC in their metric for using hospitalization, severity of the disease, and case counts, we remain the second week of low. We're fewer than 200 cases per 100,000 at 132.87 cases per 100,000 in Barnstable County, and 9.5 is less than 10 per 100,000 population for hospitalization, and our percentage of beds used by patients with COVID is 2.7%, which is well below the 10% threshold, and so we remain in the low category for the week. If you look, this is from the same website as the CDC's website. It shows, the leveling to a drop to a leveling of new admissions, daily beds used, and ICU beds used. So we're not at a point where the hospitals are stressed, and that's going to be the main factors, hospitalizations and stresses on the hospitals going forward, and we're not at that point, and so we remain green. Case counts were similar to the last week. I think there was 1,800 or so for that particular day of last Thursday. This particular Thursday was 1,700. So similar. Positivity was sort of similar. So we're sort of in a similar pattern the last couple of weeks in terms of case counts and severity throughout the state. Trends we've been pretty flat with the deaths. Again, vaccine boost, Paxlovid. Know a lot more about the disease. The deaths remain on the lower side. Positivities on the decline. Cases are on the decline-ish, as is hospitalizations. MWRA, it's a little hard to read this chart, but there's no spike. This is reading viral RNA signals in wastewater at the greater Boston area treatment plant, the MWRA. Looking at it more closely, on the left is the south system, so Quincy over to, out that way, and then the North Shore would be in green. North Shore shows a little bit up, sort of wobbling around there, flat to slightly up, and it shows you going on a downward trend in the southern system, but not, no spikes. This more recent one that we had in May, it's still more on a downward or a flat trend from there. As far as our incidence rate, we're sort of in the middle. All of Massachusetts was 20.7 for the same time frame. We were at 17.4. That means how many cases with the population was daily cases if the population was adjusted to 100,000 for each town. Some towns are ahead, some towns below. We're sort of right in where a lot of the towns are grouped in the teens. Our percent positivity, we've had quite a few more towns above us, a few towns below us, and we're sort of in the middle. Slightly below the state average of positivity for the same time frame of 5.66, and this one with us being roughly 5.49, so essentially very similar to the state. This case, they show this every week, no change in this. As far as fully vaccinated individuals, the rate of hospitalization, if you do get COVID and you've been vaxxed, is 1.62, and death rate of 0.5%. So that's pretty stable number there. Okay, the main thing I want to talk about today is the eligibility update for vaccines. So the state just said children aged 6 months through 4 years old, okay, it's already been approved for 5 and older, who live in Massachusetts are now eligible for the COVID-19 vaccine. And so this is the website. If you went and Google, looked up the mass.gov, it comes right off of that. There's some websites and some links. Where you're still going to look for vaccine, it'll be VaxFinder, okay? But you do have some links there if you want to visit the site. So that's, you could just type in mass.gov, vaccine, 6 months to 4, and this comes right up. So again, VaxFinder is going to be where you're going to go, regardless of age. Pharmacies, convenient MD, community health centers are doing it. Homebound, those that can't make it to a clinic should be calling the health department. We can get somebody out there to do that. As of earlier this week, there's plenty of open slots for 5 and above, definitely. Under 5 years, I'm saying right now, I'm going to show you another slide in a minute. I would contact your pediatrician first, whoever the healthcare provider is for your child, first and foremost. You could do it in layers, take the appointment if you can get one, and keep looking if you get one sooner, if you really want to get one quickly. Testing hasn't changed, mainly home kits. This hospital and convenient MD and the pharmacies are still doing it. So let's go jump into this. So on the right, if you go on VaxFinder, if you've never been on VaxFinder, this comes up like this. You put in your zip code. I put in 2536, and I said 6 months to 11. And most of them that come up are 5 and above. So what you see for CVS's and so forth, is still mainly 5 and above. So even though the CDC and then the states just adopted the the 4 and under, 6 months to 4 age group, the vaccinations, most vaccinations that occur in that age bracket happen at your pediatrician's office. I think they're going to be the primary place of vaccinating. Most places weren't vaccinating that age group for whatever liability reasons or whatever. Anyway, I know, when you do flu clinics and so forth, so the younger ages get trickier to do, at least from a risk standpoint. So maybe you might start seeing, places like CVS just take a stance that we're only going to do 5 and up. They may come down and say we'll do 2 and up or 3 and up. So you're going to, I don't have all the answers for how you're going to do it. I would say that I'd strongly recommend to contact your pediatrician's office to schedule that. I did pull out those that did not just say 5 and above. I pulled some out for you just to show you what it looks like. Westport CVS did have 18 months and older, as did the CVS in Plymouth, but that didn't show in any of the Falmouth ones. South Coast is the same thing as Cape Cod Healthcare, just for the South Coast. So from Fall River, New Bedford, that area, Wareham, all fall into South Coast Health. They actually have a healthcare location that they're going to do 6 months and above. You might see something come down within a week at Cape Cod. I'm not sure. I'm not privy to any information that might be on what's going to happen outside of the pediatrician's offices for vaccines. The Fall River had one. Raynham had 18 months over. The Mashpee Walgreens had 3 years and above. So I think you're going to have to keep checking that, but I would first, again, DTaP and all these other vaccines are done through your pediatrician's office. I think, I may have some more information by next week on what you could do besides that, but you want to reach out and start there and go from there. And it'll take a little bit of time. It always does when you open it up to a new grouping of people. And it's a little bit trickier when you get into these younger years and who wants to take on, on vaccinating that age group. And you may not have as many places to go at that age group, and you might have to wait a little bit longer. I'm not sure. But VaxFinder and your pediatrician is where I'd start if I had a child at that age. Vaccinations, I think we only gained 40 doses for the entire week. That's what the state had for numbers, so I'm showing them for the particular week. It was only 40. I think we'd have more, but that's what the numbers that were posted. As far as the variants, like I said before, they come in waves. The original Omicron in purple goes away to the BA2, which is going away to the BA2.12, which looks like it's slowly going away from 4 and 5. We'll start taking over for 12, which took over for 2. So that's kind of the waves that we get. And as long as they stay more where we are, we can coexist with it. As long as we're not getting it go into the more severe direction. Each one of these spread better than the others, and that's just what these things tend to do. So as a recap, case counts are level. Not great. I think 40 PCR tests, there's some multiplier higher when you start adding in the home kits. It's around. We're considered low, but it's still around. Plenty of vaccine and testing capability. So we still have, home kits are readily available. The testing sites are still around. Vaccine is definitely still around. Plenty of slots if you're 5 and older. The 6 months to 4 years that was just recently approved, it might be a little trickier at the beginning to figure out. So like I said, start with your pediatrician's office and keep on VaxFinder. There's currently no mandates in town at the state level either. There is an advisory that the select board have for town-owned buildings that's still on there. But there are no, there are no talk at the state calls or anything like that about instituting any mandates. Your individual circumstances will dictate what you want to do with that. And so that's what I have for the week. And we'll see everybody at the next update. Thanks.